Listening Comprehension Test. Instructions. This listening comprehension test will measure your ability to understand spoken English. It is composed of 3 video scenarios and 3 audio scenarios. There is a test booklet and an answer sheet. All the answers should be marked on your answer sheet. Do not write in your test booklet. In this test, there are different kinds of questions, so listen to the instructions carefully. There are 2 types of questions on this test. Number 1. Some questions are written in the test booklet together with the multiple choice options. Your answers to these questions must be selected by blackening the best answer on the answer sheet. Number 2. Other questions are in chart form. These charts are only on the answer sheet. Your answers to these questions must be selected by blackening the best answer on the chart on the answer sheet. The example scenario on the next page, page 2, gives you a chance to practice using your test booklet and answer sheet. Please turn to the next page, page 2 of this booklet. Now, open your listening answer sheet to page 1. Medical office interview. Example scenario with practice questions. You will view an example of a video scenario and answer some questions to practice for the test. These questions do not count for your score. These questions will give you practice before the test begins. In the shaded area below, read questions 1 and 2, then look at the choices A, B, C, and D. Now, look at the shaded area on page 1 of the answer sheet. This is where you will select your answers for questions 1 and 2. In that same shaded area on page 1 of the answer sheet, you will see a chart for questions 3 and 4. All the information you need is in this chart. Look at the choices in the chart before viewing the video. While viewing the video, blacken your answers for all 4 practice questions on the answer sheet. These questions do not count for your score on the test. You will now have 30 seconds to read questions 1 through 4 before viewing the video. When you have decided on each answer, blacken it on your answer sheet. You do not have to wait until the video ends to answer the questions. The video will now begin.
Hi Kim, how are you today?
Hi, how are you?
It's been a long time since I last saw you. It's several years now.
Yeah.
That's a good sign. What's bringing you to the clinic today?
I've been having some pain around my belly button. Some sharp pain.
Okay. I'm just going to ask you a couple questions, okay? Because your chart's a little bit out of date, and then you can tell me definitely what's going on with you. Do you have any reactions to drugs, medications at all?
No.
Your dad, I thought he's 42 here. This was a couple years ago. How old is he now?
About 45.
And is he still working? He was working for the Army base at one time. Is he still doing
Yes.
that? Yeah. It's some kind of clerical job, I believe. Is that right?
Yeah.
Okay. And your mom?
You will now have 30 seconds to check your answers. To check your answers, please turn to page 3, the next page of this test booklet. Example scenario: medical office interview. Check your answers. For example number 1, the correct answer is C, so you should have blackened C on your answer sheet. For example number 2, the correct answer is A, so you should have blackened A on your answer sheet. For example number 3, the correct answer is C, so you should have blackened C on your answer sheet. For example number 4, the correct answer is A, so you should have blackened A on your answer sheet. Please note, if you wish to change an answer, make sure that you erase your original answer completely before marking the new answer. There is space on your answer sheet where you can take notes if you wish. Do not write in this test booklet. You are now ready to begin the cell band listening assessment. Make sure that you are still on page 1 of your answer sheet, where you will write your answers to part 1. Now turn to page 4, the next page of this test booklet, to begin part 1. Part 1. Video Scenarios. This part of the test contains 3 video scenarios. You will hear them only once. In each scenario, you will have some time to read the questions or the charts before the video begins. After the scenario, you will have some time to check your answers. Read the questions in your test booklet and blacken the correct answers on your answer sheet. Scenario 1, questions 1 through 8. College Health Clinic, Nurse and Patient. You will now have 45 seconds to look at questions 1 through 8 on pages 4 and 5 before the video begins. The video will now begin.
So how can I help you?
Well, I feel really sick. I just threw up and I have a really bad headache. I think I might have the flu.
Okay. What do you mean by sick?
Well, nauseous.
And how long have you felt like this?
Well, about half an hour.
All right. And do you think you've had a fever?
Yeah, maybe a little.
Okay. And what were you doing when you threw up?
I was just sitting at my computer working on a research paper, and I felt really nauseous all of a sudden, so I just ran to the bathroom and threw up.
Okay. And did you eat today?
Just my usual breakfast.
And what was that?
A muffin, juice, coffee.
All right. And did you feel sick after you ate?
No, not really.
Okay. And was there anything unusual about your morning?
No, I don't think so. I was a little rushed, so I ate my breakfast pretty quickly before I left for school.
Okay. And are you still feeling nauseous now?
No, just a little dizzy and lightheaded.
Okay. Do you have any medical conditions?
No, I'm usually really healthy.
And are you on any medications I should know about?
Nope.
Well, let's take your blood pressure and your pulse, and we'll check your temperature and see if you have a fever. If so, we can give you some Tylenol. Are you allergic to any medications?
No, my headache's really bad. Do you think I could just lie down for a while?
Sure. We only have one bed in the clinic, so if anything more acute comes in, we may have to ask you to give up your bed.
Okay, that's fine.
Okay.
If I don't feel better soon, I think I'll just go home. Could I use your phone to call my mom for a ride?
Sure. You can use this one.
Thanks.
You're welcome.
You will now have 1 minute to check your answers. Scenario 2, questions 9 through 18. Nursing station, female nurse and female manager. The chart for Scenario 2 on page 2 of your answer sheet has all the information you need to make your choices. You will now have 45 seconds to look at questions 9 through 18 on the chart on the answer sheet before the video begins. The video will now begin.
Carla, do you have a minute to fill me in on your patient in 808 bed 2?
Sure. 808 bed 2 is Mr. Langdon. He's an 81-year-old gentleman, ACP3 patient of Dr. Butu. He came in last night with congestive heart failure. He presented at the emergency room with shortness of breath. Let me see. He's on 2 liters of oxygen with nasal prongs, and his oxygen saturation is 95%. He's not complaining of shortness of breath now.
Okay, and how are his vitals?
Well, his vitals are all stable. The doctor started him on Lasix last night. He had an IV dose last night, and now he's on oral Lasix twice a day. Let me see. He has a Foley catheter, and it drained 700 cc's of straw-colored urine last night. Also, he's on a 1.2 liter fluid restriction and strict ins and outs. He can have a regular diet as tolerated.
Okay, that's good.
He's also up and independent with a walker. He's alert and oriented with no complaints at this time. Oh yes, family was in to see him this morning, but they just left. They said they'll be back tomorrow.
Okay, that sounds good. Let me know if you need any help.
Thanks.
You will now have 30 seconds to check your answers. Scenario 3, questions 19 through 33. Clinic, nurse and patient. You will now have 90 seconds to look at questions 19 through 33 before the video begins. The video will now begin.
Hi, Lisa. My name is Diane. I'm one of the nurses here at the clinic. I understand this is your first visit here.
Yes, I'm glad to get in. I just want to make sure that everything's going okay with this pregnancy. And my family doctor suggested I see Dr. Khan.
Okay. I see from the chart here that you've been experiencing some spotting.
Yes, that's why I made this appointment. I've had a bit of spotting and I'm worried that I might miscarry.
Okay, well, it's a good thing that you came in. Spotting is definitely something that you need to have checked out. How often have you been having the spotting?
Well, it's only been once, about 3 days ago. Since then, I've been trying to take it easy, worrying that it might happen again.
Okay. Well, we're going to just fill out a form here. I'm going to ask you some questions, and then the doctor will come and see you and check things out. Okay?
Okay.
Can you tell me about your normal menstrual cycle?
Well, it lasts about 5 days and is about every 28 days.
Okay. And when was your last known period?
It was October 19th.
So this is January the 15th. So you are near the end of your first trimester.
Yes, I think I'm about 10 weeks.
And your last menstrual period, was it the same or different?
I don't remember anything different. It was pretty much the same.
Okay, I'm going to ask you some questions about past pregnancies. How many times have you been pregnant?
I've been pregnant once before. I have a son.
And what's the date of his birth?
Noah was born May 26, 2004.
Okay, so May 26, 2004, and you've had only one pregnancy, no miscarriage or abortion?
No, I haven't.
Okay, you have a son, Noah. Is he in good health?
Oh, he's been pretty healthy. He's really high energy.
And what was the weight of Noah when he was born?
He was 7 pounds, 3 ounces.
Did you have a vaginal delivery?
Yes.
The doctor will see you in a little while and check out the spotting. I need to ask some questions about yourself to evaluate any potential risks to you or the baby during this pregnancy. Do you smoke?
No, not anymore. I smoked a bit before I got married, and I quit before I got pregnant with Noah.
That's good. Do you drink alcohol?
Well, I've heard a lot about the dangers of drinking when I'm pregnant, so I don't drink when I'm pregnant. Otherwise, I might have a little wine now and then if I go out for dinner or have friends over. But that doesn't happen much since I've had Noah.
Okay. Do you drink coffee?
Yes, I like drinking coffee in the morning. Last month I couldn't keep it down, but I'm back to coffee again.
And how much coffee do you drink?
Maybe 2 or 3 cups.
Okay. And do you drink coffee later in the day?
No, I don't drink any afternoon.
Well, you need to know, Lisa, that it's suggested that you should not drink more than 1 cup of coffee a day while you're pregnant.
Oh, I didn't know that. Well, I'll definitely try to cut down.
Good. How are you feeling generally apart from the spotting?
Well, I've been feeling a bit nauseous, but that seems to be getting a little better.
Okay. Are you able to take regular meals?
Well, in December, I couldn't really eat anything in the morning, but by noon I was able to eat a light meal, and supper seemed to be fine.
Are you taking any prenatal supplements right now?
Yes, I started those in November.
Good for you. So would you say your appetite's back to normal then?
Well, I wouldn't say that, but I'm not throwing up anymore, and I'm able to eat a little breakfast now.
So when you were throwing up, how often was that happening?
Well, in December, I'd only throw up if I tried to eat anything in the morning.
Did you experience any weight loss?
Yes, in December I lost about 5 pounds, but I've gained that back now.
Okay. And what about bowel movements? Are you constipated at all?
No, I don't have any problems there. I usually have a bowel movement every day.
And how are you sleeping? Do you feel rested in the morning?
Well, yes, if I sleep through the night. In December, my son Noah was sick for a week, and he'd usually wake up once in the middle of the night every night. So I'd get up, and then I couldn't get back to sleep. So I was pretty tired during that time. And generally, I just don't have enough energy to keep up with him by the end of the day.
Does Noah take a nap in the daytime?
Yes, he usually takes a nap, but then he goes to bed later on in the evening. He's pretty high energy.
Okay. Are you feeling stressed at all?
Well, in December I was pretty stressed, and the spotting is worrying me now.
How about your home situation? Do you have any help at home?
Yes, my husband's really good with Noah, although he works from 8 in the morning till about 6 in the evening and is pretty tired when he gets home from work. But after supper he plays with Noah and usually puts him to bed around 8:30.
Okay, well, it sounds like evenings are a bit of a break for you then.
In a way, I have to clean up after supper, and there's some odd jobs that need to be done at the end of the day.
Is there anyone else to give you some help?
Yeah, my mom just retired this year, and she lives about 5 minutes away. If I call her, she comes over. She's really good for that, and Noah really loves her.
Well, that's good to know. It's nice to have her around, I'm sure.
Yeah, I don't know what I would do without her. She's babysitting him right now.
Good. Well, that's the end of my questions, Lisa. I'm going to do your vital signs and take your weight, and then Dr. Khan will come in and do an examination on you, okay?
All right, sounds good.
You will now have 90 seconds to check your answers. Part 2. Audio Scenarios. This part of the test contains 3 audio scenarios. You will hear them only once. In each scenario, you will have some time to read the questions or the charts before the audio begins. After the scenario, you will have some time to check your answers. Read the questions in your test booklet and blacken the correct answers on your answer sheet. Audio Scenario 1. Questions 34 through 40. Phone dialogue number 1. Nurse to family member. You will now have 45 seconds to look at questions 34 through 40 before the audio begins.